The state's trying to make universal healthcare happen. Brought to you by Whole Washington for universal healthcare in Washington State. First, a disclaimer. This list is probably not exhaustive. Let me know in the comments if I missed any states or if any of my details are incorrect. And this is about single-payer healthcare like Medicare for all, but at a state level. First state, Washington State. Washington State is the home of Camilla Jayapal, House sponsor for Medicare for all at the national level. Whole Washington and Healthcare as a Human Right Washington are the current active universal healthcare groups. 3 initiatives have been run but have not yet qualified for the ballot. Bills are currently active in both the House and the Senate with modest sponsorship. We have not yet gotten a hearing in either chamber. Detailed legislation exists with a funding model well established. A state universal healthcare commission was established in 2021. In 2025, our big win so far has been passing Senate Joint Memorial 8004, which means that the Washington State Legislature has formally endorsed universal healthcare and asked the federal government to assist it. Oregon is our next state. Oregon has a group called Healthcare for All Oregon. They pushed for the Universal Health Plan Governance Board at the state level that has a plan due to the legislature by September 2026 that would provide comprehensive care to all Oregonians. There are 3 options for how this can work out. The first option is that the legislature approves what the board puts forward. The second option is that they punt it to ballot to have Oregonians vote on this. And the third option is that they ignore it completely, in which case Healthcare for All Oregon will run their own initiative based on that bill. California is our next state. In California, National Nurses United and their local chapter, California Nurses Association, are the main universal healthcare groups. CalCare is their plan, and it has almost made it to the floor. It should have, but it got blocked by its main sponsor in 2021 because he had fear of alienating his fellow assembly members. California has a Healthy California for All commission to study feasibility of universal healthcare. And California also has Medi-Cal, which now provides access to low-income, undocumented residents, meaning nearly all Californians can get healthcare. New York is our next state. New York is the home of Alexandria Ocasio-Cortez, a big supporter of Medicare for all at the national level. The Campaign for New York Health is the main universal healthcare coalition. The New York Health Act is their legislation. It has a robust financing model based on payroll tax, which is similar to Washington State's. The bill passed the Assembly in 2015, 2016, and 2017. It is active in the Senate and has support in both chambers, but has not yet gotten a hearing in the Senate. Minnesota is our next state. Minnesota has the Minnesota Health Plan, but it's also the group. They have bills in the House and the Senate with modest support. It would be funded through a premium and a business tax. In 2023, Minnesota expanded healthcare for children, and this is in addition to their medical assistance program for low-income people based on Medicaid expansion. Colorado has Healthcare for All Colorado as its main group. In 2016, the Colorado Healthcare Initiative would have created Colorado Care, a single-payer system. It would have been funded by payroll tax, but was rejected by 79% of voters. The current win for Healthcare for All Colorado was to pass a bill that requires Colorado to analyze the single-payer legislation. Vermont. Vermont's pretty famous. First reason is Mr. Bernie Sanders, who is a very vocal proponent for Medicare for All in the Senate. Vermont Healthcare for All is the main group. Vermont passed single-payer healthcare in 2011 with the Green Mountain Care Initiative. So it passed the House, the Senate, and signed off on by the governor. The problem was it did not have a funding model. So it was killed in December of 2014 because the governor and the state could not come up with $2 billion of excess revenue that they would have to make to pay for the Green Mountain Care Initiative. In 2021, Vermont Healthcare for All introduced a bill starting with universal primary care, starting with children, and then transitioning to covering everyone. It had 44 co-sponsors in the House, but did not get a hearing. In 2024, Vermont lawmakers launched the Universal Healthcare Caucus at the state level. Hawaii is our next state. Now, Hawaii is pretty famous for a different reason. Hawaii has the Prepaid Healthcare Act that provides many soft universal healthcare objectives, leading to a low rate of uninsured around 5%. What makes this particularly impressive is A, this was passed back in 1974, and B, Hawaii's uninsured rate was 30% back then, and now it's at 5%. Hawaii has single-payer legislation in the Senate called Malama Care. It only has one sponsor in its Senate. Massachusetts, another famous state for healthcare. Massachusetts has MassCare as the main group pushing to establish Medicare for all. In 2006, Massachusetts passed healthcare reform that paved the way for the Affordable Care Act. It provided subsidized coverage for those with low income and more. Massachusetts has the lowest state uninsured rate at 2.9%. MassCare has Medicare for all bills in both the House and the Senate with modest support. And just like the other states, it got stuck in committee in 2025. Want to help universal healthcare succeed in Washington? Check us out at wholewashington.org. Also, check the description for links to the other organizations talked about in this video.